Radiation therapy is a modality that is used against cancer in roughly 1 patient out of 2. It can be used in curative intent or palliative intent. Radiation therapy has made a huge technical evolution these last 10 years with the introduction of advanced delivery techniques such as intensity modulated radiotherapy, stereotactic radiation therapy, and now proton therapy and particle therapy in general. So it is of utmost importance that for some disease where we don't have robust level 1 evidence, that we collect data of patients treated with this extreme advanced radiation technique.
E2-RADIatE is a collaboration between ESTRO and the EORTC. It's a platform that will collect data on radiotherapy usage, techniques, approaches that is used in all European countries. And the idea is, based on this data, is to answer questions about the efficacy and safety of new techniques or new approaches that is not doable via the classical randomized clinical trials.
While the EORTC has the infrastructure and the competence to drive such a major research project, the ESTRO can rely on a very big group of enthusiastic and knowledgeable radiation oncology professionals who want to drive the field forward and who want to do this in the best interest of the cancer patient.
The 2 cohorts we have at present is OligoCare, which looks at oligometastatic disease, and the second one, which will soon open, is called ParticleCare and looks at the use of particle therapy.
While local treatment strategies for oligometastatic cancer patients have been used quite extensively over the last few years, the clinical evidence that is underpinning this strategy is still rather limited. And that is exactly what OligoCare wants to do. OligoCare is the first prospective cohort study that was initiated under the E2-RADIatE umbrella, and it collects real-world evidence from oligometastatic cancer patients treated with radical radiotherapy in the context of a multimodal treatment strategy. The aim of this study is to collect patterns of care data, but also to learn more of the treatment itself, but also of tumor, patient, and staging characteristics that may impact the outcome, especially overall survival. Patients that are diagnosed with breast, lung, prostate, or colorectal cancer can be included in the study, and actually the study has been developed quite pragmatically. That means that there's no upper limit in number of metastases to be treated, there's no limitation in the timing nor in previous treatment strategies.
ParticleCare will capture prospectively data on patients, mainly head and neck, colon cancer, esophageal cancer, lung cancer that are treated with protons in Europe. The aim of particle therapy is, of course, to look at the factors that will determine the optimized outcome of these cancer patients treated with protons.
With the platform, we can also look or create other cohorts which would look at other questions that are important in the radiation therapy community. So with the data we'll collect in E2-RADIatE, we're hoping that we will be able to identify techniques or approaches that would benefit the patient in terms of better tumor control or less side effects from treatments. And by collecting a lot of data, you get a better picture than on a small number of patients. So the idea really is to see the patterns of care and to identify the ones that are best for patients. Improving radiation treatments for cancer patients and reducing the side effects of these treatments is one of the important goals of the E2-RADIatE platform.
We really hope that you will be one of these enthusiastic collaborators that will include patients in this truly innovative, unique, European, multi-stakeholder research platform, E2-RADIatE.